As you know, basal liposuction and fat injection is one of the main procedures I specialize in. And over the last 10 years, I performed more than 400 buttock augmentation by fat injection. But the reason of the conversation today is recovery from liposuction, and in particular lymphatic drainage massage. So lymphatic drainage massage means massage, first of all, on the lymph nodes. The lymph nodes are basically little pumps that are supposed to take the fluid out from the tissues, analyze it to screen it as an immune system, and then bring the fluid back into the general blood circulation. Emptying the lymph nodes after surgery is a job that can be done by exercising and certainly by a therapist who is supposed to massage the lymph nodes and help them then to be more efficient in extracting the fluid, which we call swelling, from the areas of liposuction. This is the reason why we do recommend to all patients to have lymphatic drainage massage soon after surgery, already from day 1 or 2. In some cases, we can also recommend to start a couple of days before surgery. But it's crucial that for the first 2 weeks, all of my patients have a lymphatic drainage massage only on the lymph nodes or on the areas where they did not have surgery. Say, for example, if you had surgery on your abdominal wall and on the back, then you can start straight away to have lymphatic drainage massage on your lymph nodes, on your axilla of the neck, or the axilla, and certainly of the groin. By doing that, your therapist can also help the excessive fluid from the upper limb to go into the axilla and then drain the axilla, and the same from the lower limbs, and the same from the head and neck. But certainly I do not recommend to have any massage, any manipulation on the areas that had surgery, at least for 2 weeks. The reason is simple. Every time you do liposuction in an area, then you're separating the skin from the underlying muscle and reduce the fat that is in between. Then these two layers, the skin and the underlying muscle or bone, they need to heal together. And that will take at least 6 weeks. While I'm doing liposuction, I spend so much time and attention, and I use all the high-tech instruments existing today to make sure that the residual fat that leaves behind the skin and the muscle is as smooth, as homogeneous as possible. And then I let the layers stay together. But it will take weeks before these 2 layers are healed. And the last thing you need is to have someone creating sharing forces between the 2 layers so that the space, rather than heal together, is open again. When that happens, the consequence is a seroma, meaning that the space that now is open again will start leaking fluid into it, and that will become a bulge that moves like water underneath the skin and will certainly need treatment. The treatment of seroma is based on, most cases, aspiration, which is done in clinic. But sometimes if the seroma is too large or is recurrent 3-4 times, then the treatment is surgical again. So there is a very simple way to avoid that. Make sure that there are no sharing forces between the 2 layers that are supposed to heal together in a stage that is too early after surgery. That's the reason why I recommend to all my patients to keep the garment on for at least the first 3-4 weeks, 24/7, including when they're having the first session of lymphatic drainage massage. This is not a suggestion, this is a medical recommendation that I'm making. And so I would like all my patients to follow that. And if that's not clear, I hope you can use this video to share with your therapist in order to follow my instructions by the book. Thank you so much.